Well, the Zika virus is devastating parts of South America and the Caribbean, and some cases of the virus are also being reported here in the U.S. It's especially important to be aware of if you're pregnant or considering pregnancy. Joining us now is Dr. Karen Carcamo, an OBGYN with the Institute for Women's Health. Thank you so much for joining us.
Thank you for inviting me.
So obviously there's a big scare right now. We're talking a lot about the Zika virus. First of all, what is it exactly?
Well, the Zika virus is transmitted by mosquitoes, and it's basically spread from Africa all the way into the Caribbean and Central America. And it's the problem is that if you're pregnant and you get infected with the Zika virus, it can we think it may be causing what's called microcephaly, which means a small brain, and other neurological problems in babies. So the warnings right now say for pregnant women not to go to the Caribbean and countries where this is occurring to protect their babies. But I think they're a little scary for women because they are 25 countries now. And I just wanted to give people some basic information. It's transmitted by mosquitoes. In people who aren't pregnant, it's kind of a self-limited infection where you have like fever, chills, runny eyes, and maybe some joint pains, which are common things a lot of people feel that are not Zika virus. And it should go away, but in pregnant women, 80% of them are not going to be affected and so or have any clinical symptoms, but the current guidelines say if you have at least 2 clinical symptoms and you're pregnant, to notify your obstetrician and that we can send your blood to the Center for Disease Control for testing.
So when you say 2 of the signs, you're talking about the fever or the joint pain?
Fever, joint pain, irritated eyes, and those are the most common symptoms people are having. But we really haven't had any cases in Texas that occurred here. There are people who traveled and returned home. The concern is there's really nothing you can do if you get the virus, and we basically watch your baby before and after they're born. But before we scare people to death, I want people to know that there are lots of infections that are transmitted by mosquitoes, the same mosquitoes, but they're relatively rare. We have dengue fever in Texas. We also have equine encephalitis and all kinds of other things that, that can be transmitted to humans, but they're still rare. And I think the biggest thing to worry about is what can I do to protect myself from mosquito bites in general. And Zika virus also affects other people, not just pregnant women, but it should go away.
Right,
and it's not as concerning.
Right.
Yeah, and so the thing is, pregnant women can use bug spray. They can use bug spray with DEET. Anybody doesn't want to get bitten by mosquitoes anyway, just to avoid the discomfort. But
an extra reason to protect yourself.
So wear protective clothing, use bug spray that if you're going to be in an area where you're exposed, and just have some common sense. And most things that cause, these eye irritations and fever are not going to be Zika virus. So if you haven't traveled, you don't need to get concerned and call your doctor or the CDC. And I think the thing is that a lot of things can affect pregnant women and everybody else, and just protect yourself against the insects.
And then, stay up to date with your OBGYN, and if you have questions, just
we're happy to answer them, and I don't want to leave people feeling like they should be in fear and they shouldn't travel. But look at the travel warnings and think about what applies to your family and what you need to do.
Thank you so much, Doctor, for joining us here. And speaking of the Zika virus, since the CDC has issued a travel alert for some popular travel destinations, travel agencies are also taking notice, and according to TravelWeekly.com, all Carnival Corporation brands will allow pregnant women to cancel their cruises in exchange for future cruise credit. Norwegian Cruise Line says they will also work with any woman who is pregnant and past the point at which she can cancel without penalty.